starting right here, ciliary processes. This is the cornea right here. This region right in here would be my limbus, making this pink coming back to my sclera. The line inside the sclera, well, we say choroid slash retina. Again, you can't distinguish them on low power magnification like this. Probably can't, because when they separate, you know, that separation is between the neural retina and the pigmented retina. All right, low power magnification showing the entire eye. If we take a look, we'll start here on the right side. Once again, we'll start the most anterior portion will be the cornea. You see a little bit of the dark thickening corneal epithelium on the inside here. Here would be my anterior chamber. If I go on the back side of the iris, here would be my posterior chamber. There's my iris right there. There's my lens. I trace my cornea going back. Once it turns pink, that's the sclera. That's the wide of the eye that continues all the way around. Here would be my ciliary body, and anteriorly then the iris. And then not really, I mean, I see a dark stain in here. Maybe if I get back here, I can make out a little bit more in terms of choroid and retina, but I can do much better with images in terms of distinguishing those. And then back here would be my optic nerve coming out back, so there's my optic disc right there. All right, let's look at the cornea. Cornea, you'll recognize in the eye, it's got a stratified squamous epithelium up on the surface, not a whole lot of layer cells thick like we've seen other places, but definitely multiple cell layers thick, flattened nuclei or oval nuclei, long axis parallel to the surface, up on the surface, so stratified squamous. Just deep to it here, a little bit of a faded slide, so it doesn't show up any well, but just deep to it will be Bowman's membrane. The stroma will be the connective tissue middle portion here, collagen fibers, alternating layers coming out, running horizontal or coming out of the screen at you. And then down here we've got Descemet's membrane, and then my corneal endothelium would be the name of the simple squamous lining on the inside. All right, higher power magnification. Got the anterior surface and the posterior surface. Just had to get rid of a lot of the stroma to see it. But once again, here we see our corneal epithelium right here. Multiple cell layers thick, not a whole lot, but squamous on the surface. A lot of times you do see debris, realize the tears and the secretion of those glands is kind of oily, particularly the secretion of the glands, and so, yes, you get a little bit of that effect sometimes on the surface there when you see the slides. It doesn't always look nice and smooth, and those are just simply if you're making a slide, the oil kind of beads up. Bit there. Here would be stroma going down, stroma still coming down, 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 down. I see a very white line here, that's my Descemet's membrane, and my corneal endothelium down below. I didn't point out, it doesn't show up very well. Right here would be my Bowman's membrane. All right, same thing here. Outside of the eye is to the left of the screen. What we've got is our corneal epithelium, a rather flattened or not too many cell thick stratified squamous epithelium, and then all of the yellow in here with the nuclei of the fibroblast in it, that would be my stroma, and then here would be my corneal endothelium here. I don't have this image, and this image is not a high resolution, it's pixelated a great deal, but there'd be a Descemet's membrane right here, just deep to that epithelium, Bowman's membrane here, just deep to this epithelium. Doesn't show up that well, will not show up in every slide well, but when it does show up, it shows up vividly. All right, my corneal epithelium again, once again, is stratified squamous, but you look, we have 1, 2, 3, 4, 5, 6, 7 layers thick or so not real thick like other stratified squamouses we've seen, but once again, look at the nuclei at the surface, they're oval or flattened, long axis parallel to the surface, making it squamous. All right, the white area we see very well over here. Pointer is right now passing through my Bowman's membrane. Doesn't show up that well on the left side of this image. This would be my stroma down here, and I have to go way down off the bottom of the screen before I get the decimase membrane and my corneal endothelium. All right, last one to take a look at here. Once again, I've got my stratified squamous. This time it's only a few cell layers thick, isn't it? Maybe 3. Okay, don't know why it's not 7 like the previous one, but definitely multiple layers. And you can see the nuclei are flattening out, long axis parallel to the surface. Over here is the stratified squamous. Up here I can make out a fairly decent Bowman's membrane. I guess I can make it out most of the length here. All of this would be my stroma. The pink in here would be collagen fibers, the nuclei would be fibroblasts. Don't really see my decimase membrane, it's much thinner, but this would be my corneal endothelium here. Oval-shaped nuclei, long axis parallel to the surface, 1 layer, simple squamous, corneal endothelium. All right, let's take a look at the ciliary body. Here's my ciliary body right here, which means the sclera would be up here. Down in here would be aqueous humor of the posterior chamber. Here are my ciliary processes coming off, and once again, I don't always see them running their full length. I see little tiny pieces like they're right just below between the R and the O down here. There's a little bit of a ligament of Zen. I see little pieces of it up here as well. I can make out, I've got a pigmented layer and then a superficial non-pigmented layer of epithelium. All right, this is the slide. When you see this one, you take a picture because you can sell it. Okay? Why ciliary body over here, lens over here, ciliary processes. I've never found the slide, seen a slide that comes all the way. I showed ligament of Zen going all the way connected. Okay? Okay, you normally just see bits and pieces. That's what you're seeing right in here, these little bits and pieces of ligaments of Zen. Here you caught one going the entire distance, the entire length there. All right, take a look at the ciliary body. You can see there's melanin in here among the pink smooth muscle, the ciliary muscle that's in there. Here's the ciliary processes. Once again, a stratified cuboidal with the basal layer being highly pigmented, the surface layer not being so. That's what makes the aqueous humor. And then these little ghost-like lines you see running through here would be the ligaments of Zen. All right? Yeah. Suspensory ligaments or ligaments of Zen are the same thing. Suspensory ligaments is a new term. Terms when they come in to anatomy come in initially like it's your anatomy and physiology textbooks, like a community college would use. They eventually will work their way up to histology and anatomy books like you use in this program. The last place they come in is your clinical medicine textbooks. And that's why I've got to kind of use both terms. They will eventually make it up there during your practice span. But if I have to use suspensory ligaments, you're going to have to raise your hand and ask whoever's giving the ophthalmology lecture, are those the same as, are those the same as suspensory ligaments we learned about? So I give you both terms to think about. Okay, if you look here, here's my ciliary body right here. I can see ciliary processes. I can see coming interiorly off of the ciliary body, as it's part still of that tunica vasculosa. Here would be my iris. Describe the iris too much here because we'll look at that a little bit later. Here's my lens right here. You can see the idea of the ciliary processes pointing up towards that, because that's where those ligaments of Zen are going to be connecting. Here would be my limbus right here, because this would be my sclera. And this anteriorly then would be my cornea. Okay. Posterior cavity. Realize the posterior chamber is part of the anterior cavity. So it's behind the iris right here, and basically a line, let's say, coming down something like this would be your vitreous body. Okay, so all this would be vitreous body back here. And so if I was going to label posterior chamber, I'd either label it here, or I could label it right here. Okay, anterior chamber up here. Sclera. Okay, here's my ciliary body. Sclera is right here. This is my limbus where everything's going on. Cornea anteriorly, sclera posterior. Limbus is a region. Yeah, it's not a nice line, it's a region. All right, if we take a look here, you can see the lens out here. Here's my ligaments and then coming across. It will be connecting to the ciliary processes. Here's my ciliary body. And interiorly coming off that ciliary body right here would be my iris. You recognize the iris because there's really not much on the surface, but a thick layer of pigmentation on the posterior surface. All right, looking at the iris now. Here we see the tip of the iris. You can recognize it once again. Well, I've got the lens down here. You can see my subcapsule, or my lens capsule, and then the subcapsular epithelium on that. I know that's the lens. Here's my iris. Iris recognized it's a little bit dark on the surface, but remember, there's no epithelium up on that surface. The stroma has fibroblast in it, also has a lot of melanocytes to give the iris its color, but the posterior surface of the iris is a stratified cuboidal epithelium continuous with that stratified cuboidal epithelium of the ciliary processes, except now both layers are highly pigmented. And so that's one thing that can help you recognize that. If we point to a pink section up here, all you have to tell me is that is muscle that controls the aperture of the pupil. And I'm going to ask you, is that constrictor or dilator? All right. Another slide, once again, same type of thing. I've got the lens right here. Here's my iris. Here's my anterior surface without the epithelium, just a connective tissue there. Here's my stroma. I can see smooth muscle in there, and the posterior surface highly pigmented here. I could also say in the anterior chamber up here, I'm in the posterior chamber back here. Right, here's one with a lot of labels to it now. And no epithelium up on that surface. You can appreciate this on this nice high resolution, high power magnification. And then I've got stroma. I've got some, in this case, constrictor muscle here within the stroma. And then the posterior surface is that cuboidal epithelium so highly pigmented you can't make out the cells. Right, this is just looking much higher power magnification. You can see that posterior pigmented epithelium here. Here is more of their saying, telling you that's constrictor smooth muscle. Just tell me it's smooth muscle, you're fine. And then they're pointing out in here, there are fibroblasts in here. They're pointing out a melanocyte. This is the melanocyte responsible for the color of your iris. All right. I mean, I've got, I think, more slides than I need in here in this. Same type of thing. Same type of thing here. Let's go ahead and look at the lens. All right, when we look at the lens fibers are the things that kind of give it away. I've got a simple cuboidal epithelium up here. And if I look carefully, here is my lens capsule going, this rather thick, going from here on down to where it turns pink. That's my lens capsule. A lot of times lens capsule jumps out when you know it's something. This you might just think it's a layer of mucus if you didn't know what you're looking at here. But that is actually a basal lamina, a very thick modified basal lamina on the surface lens capsule. They've got the arrows pointing in the wrong place. The arrows should be pointing up here. Okay. Should be pointing up here. That's the reason if you've ever done this on a PowerPoint to make this the image a little bit and didn't realize it before I snapped a picture of it. And these would of course be my lens fibers. If you look, these are alive out here. Get the idea these are dead or dying. A little bit difference between what's on the periphery versus what's more internally, correct? And that's the nature of those lens fibers as we talked about that. All right. What often happens here when they make the slide is that the lens fibers separate. Now, I've got junctional complexes that are meant to hold them together because they aren't very well attached, but they don't stay together real well. I mean, you see plenty of little small tears in here. Those are artifacts of the preparation. This major tear right here is definitely an artifact of the preparation, but that's quite commonly seen. If we look at the lens, if we look at a low power magnification, I can make out the pink lens capsule on the outside, my subcapsular epithelium, and then low power magnification without a great deal of resolution, these are all the lens fibers in here. And once again, they often come apart, separate out, and so you'll see those tears or just small little openings in there. All right, retina. All right, we look at the retina. Here would be my, top of the screen, here would be my vitreous cavity. And so these are this first layer of nuclei. There shouldn't be as many of them. Should be the fewest number of, and within this layer, those would be my ganglion cells. What's this layer up here between the ganglion cell nuclei and the vitreous body? That's where their axons are coming up and all then going, I don't know, they're going left or right to go to the optic disc and leave to the optic nerve. Leave the eye to the optic nerve. Next layer of nuclei in them would be primarily my bipolar cells. We said there's amacrine, there's Muller cells, there's horizontal cells in there, but they're minor players, so they just labeled it bipolar cells, which is how most books will do so. They may show others in a drawing. Then here's the layers of my rods and cones. Down here would be my segments, my inner and outer segments here. So my photopigments are down here. And typically we're gonna have some separation. You can see complete separation here between the rods and the cones, the photoreceptor elements of the rods and cones, and my pigmented epithelial layer down here. Okay? Remember, normally the tips of the rods and cones are being bathed by these microvilli because these are phagocytizing the bottom of those rods and cones, the old, worn out vesicles of the photoreceptor pigments. Okay? So here's my pigmented epithelium of the retina, and that would be the choroid just deep to it. All right, just looking at right now down at the rods and cones. So how do I know that? Well, let's go what I do know. Here's my pigmented epithelium. I can see a simple cuboidal epithelium, one layer of round nuclei. Remember, these will be all those microvilli here, that's where all the pigment is located within those. And then I've got a little bit of separation. It's the same slide as previous. A little bit of separation here, and I can then make out the idea that I've got my photoreceptive pigments, my rods and my cones. They don't stand out very well in terms of the rods and cones like the one I showed you in the textbook. But here are my photoreceptor, here's where light is defective, my photoreceptor elements down here, and here would be the nuclei of my rods and cones. We go up higher, next layer of nuclei would be bipolar cells. All right, I'll look here. Thing that jumps out at me first is the choroid. Okay, see that? That must be sclera down here. Just above the choroid here, that must be my layer of pigmented cells. Which means here's where the photoreceptors are for my rods and cones. Here's nuclei of rods and cones, nuclei of bipolar cells, nuclei of ganglion cells up here. Okay, this layer up here would be my axons, my ganglion cells, and that form the optic nerve. Don't worry so much about inner nuclear layer, outer nuclear layer, and so on. Ganglion cells, bipolar cells, rods and cones, nuclei. Here's where my photoreceptor pigments are. Here's my pigmented epithelium. That's what I want you to know, rather than inner, outer layers and so on. All right, we take a look here. If I'm going along the surface here, I've got a little divot into the surface, don't I? Got a little divot in the surface of the retina, and I know it's the retina because here's my choroid right here. Sclera out here. This would be extraocular muscle that moves your eyes out here. But if I've got a divot coming down, a dimple coming down within the retina, it could either be the fovea centralis or it can be the optic disc. Okay? If I take a look, if this is my choroid right here, this line right here would be my pigmented epithelium, which means if I come to the edge, nuclei of rods and cones, nuclei of bipolar cells, nuclei of ganglion cells, correct? If I follow the rods and cones, they continue all the way across that divot, don't they? That would tell me I'm at the foveus centralis. Okay? Light doesn't have to pass through all those nuclei of bipolar cells and ganglion cells before it gets down to these photoreceptor pigments down here. That's why you have the best visual acuity. You also have the highest concentration of cones. You can see color there, the best, at that foveus centralis. Compare that to this image right here. I purposely put these back to back. I also have a divot within the retina. If I come over here to the edge, I can make out choroid. Then I've got a line of pigmented epithelium, nuclei of rods and cones, nuclei of bipolar cells, nuclei of ganglion cells. If I follow the rods and the cones nuclei, they come here and they stop. If I did from the other side, here's rods and cones nuclei, they come here and stop, and then I've got a region here that doesn't have any rods and cones, no photoreceptor pigments. That's got to be my anatomical blind spot, which makes this the optic disc. Here I've got a very thick layer of all those axons or ganglion cells filling up. It's going to take a downward turn right here, become the optic nerve, and you can see from where it goes from a yellowish white to more of a pinkish color, that's where you begin to myelinate those axons. I promise you, if I had this put on the exam, I'll give you the opportunity to misidentify this as a foveus centralis. Okay? And so be able to distinguish between that and that. All right? We take a look here. I've got a little bit of divot and don't see the other side of that divot, but I can make out my choroid, see my sclera down below. Here's my pigmented epithelium. Running right across here. I can see the photoreceptor elements of the rods and cones running across. Here's the nuclei of rods and cones, nuclei of bipolar, nuclei of ganglion cells. If I look at the rods and cones, they continue across that divot, but the bipolar cells and ganglion cells do not, for the most part. Okay? That tells me I'm looking at the foveus centralis. All right, once again, follow on this one. Low power magnification. I can make out my dark choroid right here. The line running across just above it must be my pigmented epithelium. Dark line here, nuclei of rods and cones, nuclei of bipolar cells above it. Superficial most up here will be my nuclei of ganglion cells. If I follow my rods and cones, they come here and they stop. They pick up again over here. And so I've got an anatomical blind spot in that divot that makes that my optic disc. Okay? That none of my neural retina continues across that. So this layer up here would be my axons of ganglion cells, which are now taking a downward turn to become the optic nerve. It's a little bit overstayed, so I don't, let's say the line would normally be about right through here where you can see it being myelinated. Looks like the line's up here a little bit closer. That may be the case on this individual, or it may just be a little bit overstayed. You can see blood vessels here inside that optic nerve. All right. If we take a look here, I can see it doesn't have any nuclei in it, but 1, 2, 3 layers of nuclei. Here's my pigmented cells. Choroid, I'm mainly just seeing blood vessels in there, aren't I? Large blood vessels. Not very thick, not a lot of pigmentation to it. That would make this the sclera out here. I think the thing that gives this away to me is here is a large blood vessel. It's got to be in the choroid. I can see my pigmented epithelium right here, not the best slides. Here would be my photoreceptive vesicles for my rods and cones. Here's a nuclei of rods and cones, nuclei of bipolars, and then very few nuclei in this region here of the retina for the ganglion cells. Okay. All right. The last thing, if I remember correctly in the slide here, is looking at the palpebra or the eyelids. Got to figure out which side is skin, which side is conjunctiva. I can see stratum corneum flaking off up here, can't I? I know that's got to be skin. I can see the be like a hair follicle coming out. The fact it's rougher, this has to be skinned. Nice, smooth, stratified squamous of the conjunctiva. You can't tell stratified squamous here, that'd be the conjunctiva right there. Here would be the tarsal gland or meibomian gland right here in the tarsus. You don't have a lot of differential staining to see the tarsus very well. I'm recognizing it more by the glands that are in it. And it's not enough differential staining even to say connective tissue versus muscle out here. Okay? You can see some things. I mean, I'd ask you more the things that are labeled in here, with the exception of the clavicular muscle. I wouldn't ask you the fat lobule either. But, you know, the things that are labeled conjunctiva, meibomian gland, duct of that meibomian gland, eyelash follicle, those would be in skin, those would be the things I'd ask you off that slide. A slide like that. All right, if we take a look here. You know this is the eyelid. Here's the skin, it's rougher, and you can see some of the stratum corneum starting to flake off. Here's be my conjunctiva right here. Can't make it out, but I know it's the eyelid, that's gotta be conjunctiva on that other surface from the skin. Here I can make out very well. Can you see where I've got a dense connective tissue with glands in it? That's my tarsus, and these would be my tarsal or meibomian glands in there. The pink I'm seeing out here, then, closer to the skin, that's gotta be my skeletal muscle. Once again, we typically don't see glands of mole, or glands of, or any of the other glands other than tarsal glands here in an eyelid. Alright, here's the best eyelid slide I've got. A little bit old, a little bit faded, but still a very good slide. Here you can see the little peach fuzz hair follicles on the surface up here of the skin, correct? Once again, if you can, that's a roughened surface, that's not what you want to do against the eye, which makes this my conjunctiva down here. I can see tons of glands, those would be my tarsal glands. And so the connective tissue a little bit faded in there, but I can still make out my tarsus. Then I've got white area in here, and when I look at it here, this is fascicles of skeletal muscle, isn't it? Okay? And so this would be your clavicularis oris or something like that that allows you to weep. Okay? And so that's, like I say, that is the best slide I've got, and that brings us into the self-review slides, and then eventually